Hi, I'm your host, Marsha Florence, but just as today our show is Sarcoidosis Awareness. Hurry back and join us. Hi, I'm your host, Marsha Florence with Just Ask. Today our show is Sarcoidosis Awareness. And we have with us the founder of Sarcoidosis, Janie Chuney. Hi, Janie.
Hi, how are you today?
I'm fine. How are you?
I'm real good.
Now, Janie, the name was kind of long for me, so I wanted to make sure that, did I get it right? Is it Sarcoidosis?
Sarcoidosis.
Sarcoidosis. I'm so sorry. Okay. Can you give us a little bit of history on, I'm going to have to practice it as I go.
Okay.
Sarcoidosis.
Well, sarcoidosis is an autoimmune disease, and it has no cause and no cure. And this disease has been around since 1879, when it was found by Dr. Beck on the skin. And since 1879 to today's date, there's no cause, no cure, and the treatment is very limited. The disease strikes many races, but in America, the African American community is affected the most, with the African American female having it 10 times more than the white female and 2 times more than the black female. The black male. Sarcoidosis is a debilitating disease that can affect every major organ in your body, cause blindness. It can cause sudden death syndrome. And what sudden death is, if sarcoidosis is found in the heart, you could just die automatically.
Okay. Wow, that seems a little strange. So it's a rare condition. And how often is it sought out? I mean, do people actually know, or what's the type of testing do they have to go through?
The type of testing you go through for sarcoidosis is actually a rule-out disease, which means when I first got sarcoidosis, were diagnosed in 1994, they thought I had cancer, AIDS, lymphoma, and Sjogren's disease, Lofgren's disease, many, many things. And then finally, after 6 months, and I lost 90 pounds and was off from work that long, they ruled out cancer and everything by giving me a biopsy to find out that it was sarcoidosis.
Okay, okay. So you didn't tell me, after all the conditions that you went through, all the changes, all the medical testing and everything, it had to rule out everything first?
First.
Okay. But did any of those symptoms appear to be of other conditions before they actually found out it was sarcoidosis?
Mm-hmm. They did, and the spot on the lung they thought was automatically lung cancer.
Okay.
And then it was in my lymph nodes and my gland, all my glands real bad. So that was continued with something else. So they don't just automatically have a screening process for sarcoidosis. And that's one of the things that we're aiming through the foundation to get better treatment for the disease.
Okay. So what type of treatment do they offer?
Treatment is very, very limited. You will use prednisone, which is a powerful steroid that causes other diseases. Like it caused me to have hypertension and diabetes. So I have out of control diabetes because I stay on it a lot. The other is cancer drugs and chemotherapy.
Okay, okay. Wow, so that's a pretty difficult condition to have and not have it diagnosed properly. Is this the kind of condition that if you go to the hospital you should ask them to test for, or how would a person even think to know that?
If you know the signs of sarcoidosis, you might ask them to test for it. It's a chronic cough, chronic fatigue, unrelenting pain. And you know, with a woman, we're usually running and doing something for somebody else, and we're just tired. That tiredness could be sarcoidosis. You have night sweats, really rapid weight loss. Because I lost 90 pounds in maybe 6 to 7 weeks. I go every 3 days to the doctor and have lost 15 pounds. That's how debilitating that disease is. So if you know the signs, you could ask, well, could this be sarcoidosis? But if it doesn't present in the lungs or presenting an area that they're checking you for, say your brain or your liver, spleen, kidneys, eyes, then no one will know what it is. So if you have any of those symptoms, you should ask the doctor, is this sarcoidosis?
Now, what about a smoker? Because it sounds like a lung disease, or it's in the lung disease family, would a smoker be affected even more so by this?
They say smokers aren't affected more, but they want you to stop smoking as soon as you're diagnosed with the disease. Because smokers, it is a little more prevalent in people who don't smoke.
Okay.
So it would be best not to smoke, and it would be better to keep a good diet, to stay and exercise if you can.
Okay. So a lot of times when we're going through the changes of trying to be healthy, it doesn't mean that you haven't done all that you could to be healthy, but you may be stricken with a condition such as this that will rapidly steal away your strength, and cause you to be fatigued, or do you have headaches, or is it dry mouth? Because I think sometimes a lot of symptoms relate to different things anyway. So is there any scarring?
It's scarring of the lungs. And right now I'm having dry mouth. You will usually always have dry mouth. That's one of the signs of it. Chronic fatigue, you just, I can't do anything else. And the bad thing about it is it doesn't stay in just one place. Mine started in the lungs and went to my eyes, and they started bleeding. So last year was the first time I actually saw sarcoidosis. And that's what made me start this foundation, along with Trinity Deliverance Church in Detroit, and my son Melvin, who's a member there.
Okay. So at the church where you guys started the foundation, is it a growing and rapid information program, or how is it done?
The program is, we gather all the information we can. We've got statistics from the National Heart and Lung, from everywhere, from doctors, practitioners, alternative medicine, to get information about sarcoidosis and how to treat it better. And that's one of our main goals. And to increase awareness, because in the African American community, nobody knows it's out there, until they get it and they'll say, oh, I never heard of it before. And that's exactly what I said. I was glad I didn't have cancer, because everybody in my family basically died from cancer. So when they say it's not cancer, I was really happy. But it's nothing to be happy about, because it travels through your body. It may go in remission and you may not see it, or you may not feel it and you feel good again, but then it came back and it'll present somewhere else.
Wow. Okay. Well, I tell you what, Janie, we're going to take a commercial break and come back with some more good information about sarcoidosis.
How do you become an organ and tissue donor? How do you talk about it with your family? For answers to these and other questions on organ and tissue donation, call 1-800-355-SHARE for a free brochure. Share your life. Share your decision.
Hi, and welcome back to the show. We're here with Janie Chuney, the founder of Sarcoidosis Awareness. Now, Janie, this is some good information, because a lot of people don't know about such conditions as this, and I'm sure by the time the word gets out, we as individuals will start to ask our physician, can he or she test for this? Now, can they just ask the physician to test for this if they have any of those symptoms, the dry mouth, the fatigue, all that kind of stuff, or should they wait till, they feel like something else is going on?
Actually, I would ask. And the bad thing with the medical community, they don't recognize it right off, or it's in your head because it's not seen. Well, you don't have sarcoidosis, we don't, they don't really recognize it. In fact, one of the things we're doing at the foundation is we're doing advocacy work to get it recognized as a legitimate disease, because you can't get disability for it, because the medical information says it comes and it goes.
Wow.
And in the African American community, that is not the case. We get the most chronic and debilitating form, and the African American female always, or 90% of the time, gets the most chronic or the fatal form, because sarcoidosis is fatal.
Okay.
And you can get it anywhere, and the repercussions of the disease are just really, really dramatic. You suffer a lot, you can't go to work, you can't get disability. So this is one of the things we're really working on now. So
are you guys fighting to get it passed as a condition that warrants for Social Security?
Yes, we are.
Okay. That's it. That's good, because, a lot of times, well, from my experience working with the Social Security Administration, they want the condition to be ongoing so that they can say this makes this payment and reason, because it's a long-term disability, or it's ongoing and things don't get better, they get worse, or they stabilize. And I can understand their concern, but a condition that goes in and out, it still should find its way into the Social Security Administration as one to be reckoned with. So if you get paid and then you do get better, if they wanted to discontinue you on Social Security, it's different. But to say that, nah, we don't recognize it at all, it's a little harsh. It's a harsh reality because you're right, you can't go to work. You know, you might can't go to school and things like that, barely can take care of your family. So they probably want that condition along with another one for a person to be eligible for Social Security.
And they want that condition along with quite a bit. We have talked with people who are in the 5% of the mortality rate, and they can't. One guy I talk to all the time, he's 6'5" and weighs 130 pounds. How can he go to work? He's in the bed all the time, he's drinking water all the time, he's infected all the time with something, and it's nothing you can do. I've talked to females. I talked to a lady in the hospital, one of my son Melvin's friends. She was 31 years old with 3 kids, and she had it in the heart and the liver, spleen, and kidneys. And she said, well, Miss Tooney, they're going to do my heart surgery today. She said, I don't really want to do it because I know I'm going to leave my 3 kids, and she did. Well, the last words she said to me were, don't stop this, continue, because people don't know about this disease. So it's really hard when you listen to that type of conversations with people. And so what we're doing is we're working now with our Tina Tinsley Hardman. Okay. And then we're going to work with Carolyn Cheeks Kilpatrick and John Conyers, who also have introduced legislation, but it didn't get passed. So we're going to try to reintroduce legislation to get it known as a legitimate disease, to get money for research and treatment, and to get it recognized with Social Security.
Okay.
That's one of the things we're doing. And we are collaborated with Wayne State University, and they're going to do a sarcoidosis treatment there. We're on the conference there. The School of Nursing and Coma are putting it in their curriculum and holding focus groups. And we are working with the American Lung Association, and I'm the official spokesman for sarcoidosis. So any calls they get about sarcoidosis, it comes to me, and I talk with the people and we send them information.
Okay.
So we are working very hard in the community, but we still need more information put out. We need to get people aware that this disease is out there. Because if they're not aware that you can be affected by it, you'll think you're getting treated for one thing and you need to be treated for something else. And misdiagnosis is what's killing us. Nobody knows we have it.
Right. Well, we hope that we can be some support to your cause. Now, you guys are 501c3 or nonprofit?
Yes, we are.
Okay, so I take it that you have phone numbers that you'd like to give us, so if someone has a question or want to volunteer some time.
Our phone number is 313-836-5693, and our email is sarcoid awareness, SARCOID awareness at AOL.com.
Okay, okay. We'll make sure that that phone number and address and web address goes up, okay, and we'll get it again from you. Now, I know somebody in the listening audience probably wants to know, is this a contagious disease?
No, it is not.
Okay, is it under the condition of disease or condition? What do they call it? Do they consider it as a disease?
They consider it a disease.
Okay, okay. So some things we don't know as a disease, they say it's a condition, and we don't want to mix the two.
Yeah, and you don't get disability for conditions. You get disability for diseases.
Okay.
You know?
Okay. So it's non-contagious.
Non-contagious.
Okay. Okay.
But it has been known to run in families.
Okay.
Because I know a lady, she has 48 people in her family having the disease. So we're trying to get grants and funding to get that information acknowledged. But we need to let people know who have it or think you have it. Give us a call, because we need statistics to get money.
Okay.
And you will never get funding if we don't have enough information.
Okay. What about treatment?
That is what one of our biggest areas that we're in treatment, because it's only treated with prednisone and cancer drugs.
Okay.
And it doesn't make you comfortable, or it doesn't cure it. It just, prednisone makes you gain weight, which is the smallest part, but it also gives you a lot of conditions. And chemo and cancer drugs, if it's not cancer, why are you treating us with it? So that's why we partner with Wayne State University.
Okay.
For them, the students, to come up with something better to teach to the next generations of doctors, because most doctors aren't familiar with it.
Okay, that's great. That's great. So the new generation of doctors, they have something to work with.
Yes,
and
they
look
will.
forward to. Okay, okay. Well, that's a good thing, because a lot of times I think what we're looking at also is things over time. So sometimes we have to go back to, like you said, generations and generations to find out what other family members have died from, or were, you know, what the illnesses were. And some illnesses are generational. They skip one group and go to the next,
Right.
you know, or somebody said, well, did you know that's what grandma had? No, I didn't know what grandma had. Grandma died before I was born, yet she had a condition or a disease that, you know, urged her death on a little early or timely. And we never really put the two together until a certain generation decides to do research to find out what's going on in their lives.
And that's an important issue you just brought up. I believe my mother had sarcoidosis because I have all the things. She was always ill. You know, she had many back surgeries. I've had one and I need another spinal operation. She had hip surgery. I need both of my hips replaced because they've been eaten away by the steroids. And I stay in chronic pain all day, every day. And if I can just get up and get to the phone, I'm going to try to help somebody else. If somebody calls, I'm trying to help you if I can only talk to you. So it's really hard to understand your genetics, who had what in your family, because somebody else might have it and it might help you.
And a lot of times we listen to family members talk about how painful they are. Oh, I'm tired. Oh, my back hurts. And we sometimes just take it in a joking manner, like their back always hurts. They're always in pain. Never knowing that the seriousness means that something is going on with them,
Right.
you know, because they say it so much and it could be at any given moment. So you're sitting right there now. If you say, oh, Marcia, my back hurts, you know, and I said, mm-hmm. But not knowing the truth is that your back does hurt, you know. And so we take for granted sometimes because we think that people just talking just to be talking, and that might not be the case. It might be that there's something going on internally, and, you know, they can feel it, but they can't put their finger on what it is. They just know they're uncomfortable at this time. There's a lot of unknown and rare conditions that we don't speak of until it actually happens, you know, and that's the bad part because we take for granted. One of them is like myasthenia gravis, where, you know, a person's at dinner and all of a sudden they just fall asleep or they got this stupor and someone says, oh, look at him, he's drunk at the table. He's not necessarily drunk at the table. He's not drunk at the table. His condition is taken present and he's out for a minute, you know, or he's, you know, uncomfortable. And someone else across the room may assume that it's got to be that this person is just, you know, out here having too much of a good time.
Right.
You know?
And people do that with sarcoidosis and other invisible diseases because you can't see it, or I always say if you're not on a respirator, you're not sick. And you said the exact thing. If you say, well, my back hurts, it's always hurting. Or they'll tell me, oh, you don't look sick.
Right.
And I not only do I have sarcoidosis, I got fibromyalgia, 3 brain disorders. I need hips replaced. I have at least 12 other diseases. So you can't tell by looking at a person how they feel or what they're going through in their life.
Right.
That's why awareness is key in this disease. We must educate the community, and not just the African American community, because other races have it. We need to educate people to be more aware of it. In the South, you can ride down the freeway and see boards about sarcoidosis. Here in Detroit, there is nothing.
Wow.
No place to go.
Well, I tell you what, Jenny, we have to go to another break, but we're going to see what we can do about getting the word out and making it more aware in the state of Michigan.
Thank you.
We'll be right back.
I can cause sudden headaches, dizziness, trouble walking, talking, seeing. What am I? I am a stroke. Learn to recognize a stroke.
Okay, welcome back, and we're here with Janie Chuney. Now, Jenny, I did get a chance to get a folder from you for some information, and I know we got a shot of you, and it's not a real clear shot, but we wanted to actually show this up. Now, this is when you had sarcoidosis in the eye?
Right. That was last year, and I just woke up, and first I went through, my eyes were just blurry. And then I went to the ophthalmologist. They said I had it in the eyes, and I got put on prednisone. And after about 2 months of intensive prednisone, I woke up, and I, you know, could feel something, and it just started hanging out my eye. And when I cut on the mirror, there was a big clot, and by the time I got to the doctor, it was bleeding all over. They bleed internally, but now they bleed externally. So that was the first time I saw sarcoidosis. That was my enemy that I didn't know.
Okay, so that actually means that the blood was coming out of your eye?
Coming out of my eye. It was coming out of the orbit.
Okay, okay. So does that mean that you had bleeding on the brain or anything?
No, it was bleeding just through the artery that leads up to the brain, or in the spirit eye.
Okay, okay.
And that's what caused us to found the Sarcoidosis Awareness Foundation.
All right. Now this package here, you got some good information here. Women help others despite rare illness. Okay, and I saw a nice article on you that was done in the newspaper. Which paper featured you?
Detroit News.
Detroit News. Okay. Victims fight for awareness of little known disease. So this is your son.
Yes,
and
that's my son Melvin.
He's representing you to get the word out so
Yes,
people
he
understand.
is.
That's a good son. Okay, okay, okay.
I also have 2 daughters on the board
Okay,
also.
well, okay, good girls too. Okay, it's good to know when family get involved. You know, it's good to know because sometimes, like I said, you can have people that don't take you too seriously, and then some people say, wait a minute, you know, she needs help here. And there's others out here that need help too. So you actually had a chance to get the word out in the paper. Did you get any feedback? Has people been responding to you?
And we got a lot of feedback from the articles. Someone will see it and call and can you come to the church? Can you come here? Can you come to our school? I think my father has it or mine has it or someone died from it.
Okay. So I meant to ask you, is there an age criteria that this condition normally takes on?
Sarcoidosis usually strikes between the age of 20 and 40.
20.
You're more prone to get it then. However, I got it at 45.
Okay.
And I just talked to a lady last week. She got it at 73.
Okay.
So I don't think there's an age variable
So people
there.
would think they're safe. They're not. Okay.
They're not.
I see a nice pen here. So, you know, is this pen for me?
Yes, it is.
Okay. Okay. I don't want to take advantage of the pen. I put my pen on right now. Okay. Thank you.
Thank you. You're welcome.
Okay. And now, I see you have support from the American Lung Association.
Right.
That's a wonderful thing. Okay. So, American Lung Association does a lot of things. And basically, can someone order some information or get this brochure mailed
Yes, they
to
can
them?
get that brochure from the American Lung Association.
Okay, and they'll give them some info on sarcoidosis and much more, right?
And much more.
Okay, now look at Janie. Can we get a shot of Janie? Probably can get a nice shot of you there. Okay.
In that article, that's what God spoke to me today that I wanted to give up. And he said, quit whining and quit worrying about yourself and turn your suffering into achievement. And that's all I kept hearing. So I want to leave a legacy that even if you suffer, do something for somebody else. Okay. So that's what the basis of this foundation is. Even if it's just a spoken word, even if we could just send you information. But we want to get funding for programs to economically distressed families. Because a lot of people may just need medicine. You may need a pair of glasses. You may need a bed. You may need your prescription filled, and those are some of the things we're going to try to do. Because I have a friend lost her home, no medical insurance, lost everything, car, everything, and had to sleep in her sister's basement because she couldn't get the disability that she needed. So we want to help people like her who really need the money.
Okay. So there's got to be a spokesperson to work with the Social Security Administration to get this condition of disease understood.
Right.
Okay, okay. And so sarcoidosis has its own brochure.
Right.
Am I saying the name right?
Sarcoidosis.
Sarcoidosis, okay. Okay, ladies and gentlemen, we're going to start practicing and get these titles right because a lot of times we're close, but that doesn't make us right. Sarcoidosis, right?
Right.
Okay. All right, good thing. So it has its own brochure to
Right.
let you have some information on it and everything. Now, can you pick these up anywhere, the library, or do you have to contact the
That's from the American Lung Association.
Okay.
And when I got diagnosed, that's the only information I had. And it's very vague. And it's good information, but it says it comes and goes. That's what stops you from getting disability.
Okay.
So we've researched much more information. And the American Lung Association, since the foundation has joined in partnership with them, they're doing a lot of things to get more information out, a lot of things to get it out in the community on the website, and they have a lot of programs they're getting ready to institute, and they're going to get a researcher together to help research the disease more.
Okay, okay. But if someone wants to speak to you in particular, since you're a nice 501c3, give us that website and that phone number again.
Okay, the phone number is 313-836-5693, and the email is sarcoidawareness@aol.com.
Okay, can you spell that for us?
SARCOIDAWARENESS, Sarcoid Awareness.
Sarcoid Awareness. Okay, okay. Because I'm sure a lot of churches would want to contact you or organizations and find out more about this particular rare disease that it seems like it's something unheard of, but no way. I mean, if you got people working along with you in the American Lung Association and a lot of our councilmen or political activists here in the state of Michigan, that's a good thing. You know,
And
that
it is
means
a good
somebody
thing.
knows something.
Somebody knows something, and we're getting ready to really, Artina Hardman is just, she's very dedicated, and she's going to help us get, the legislation and get the information out and hopefully get the funding. And we do need funds in order to keep sending out information, doing the phone calls, doing the outreach to the community. And we need volunteers to help with the conference and many other things that they could do.
Yeah, now volunteers are important. A lot of people don't think that they have the time, but ladies and gentlemen, 2 hours, 1 hour even, is helpful when you're volunteering.
If you can make a phone call, that's helpful.
It is.
It is, because we get many, many phone calls and many requests. We even now getting phone calls after I was on another talk program, is Making a Difference with Richard Bernstein on Channel 62, and it aired for 5 days during the week of 1 week in September. And we got calls from Ontario, Paw Paw, Michigan, Mackinac Island. So it's not just a black disease, it's a disease that affects many, many people. We just get it the most.
Okay, so it's a people disease.
A people
okay, we don't
disease.
want to confuse people because someone said, "Oh, it's only for the African American women." I'm like, I don't think it's only for. Okay, but we African American women predominantly. Okay.
Get the disease the most and get the most chronic form.
Okay, okay. Well, Jenny, I tell you what, we want the public to know that they can get this information. They can call you or email you and get a package of this important information about
they can.
So, you know, ladies and gentlemen, it's not just one piece of paper. Look how thick this is. So we know that this condition does exist, disease rather, does exist, and it's got a history on it. Yep.
Right.
Since 1879.
79.
Wow, I'm thinking you're going to tell me 1979. Okay.
1879, and they've done nothing but research.
Okay.
Cure or treatment is not perfected.
Okay. All right. Well, we're going to work on that, and hopefully we can get some support for you.
Thank
okay.
you.
Okay. So I want to thank you so much for coming by to see us, and do feel free to keep us posted and come by and see us again.
And I thank you so much for giving me the opportunity to tell my story.
Okay.
Because it's a big story that needs to get the front pages, and you're right now putting me out there for the front page.
Okay. You're welcome.
Thank you.
Well, ladies and gentlemen, as usual, you know who I am, your host, Marsha Florence, Just Ask. But realize that there's a lot of things going on out in your community that people don't know about or have very little information about. You can call us, write us, email us, or even go online and talk to us. Our number is 248-988-0250, 248-988-0250, and believe it or not, that's a 24-hour number. No excuse so you can't call us. Also, we have a website, which is justasktalkshow.org. That's justasktalkshow.org. Drop us a line, check out our site, let us know what you think. Feel free to leave us a message of some sort. And don't forget, we're still working with the Disability Magic Makeover, which some of you don't know about, but we're going to clue you in real soon. So I'm your host, Marsha Florence, for Just Ask. I want to thank Jenny Chuney for joining us today, and we're going to help her get the word out about this rare disease, sarcoidosis. Did I say it right?
Yes, ma'am.
See, I'm good. I'm practicing. All right, ladies and gentlemen, like I always say, if you know someone with a disability, don't be afraid to ask. Just ask. Also, if you just have a general question, just ask that too. I'm your host, Marsha Florence. Thank you.
Cover this Jesus as he grows up and as he comes closer to his Father, as he struggles to do the Father's will. Struggles. You don't think Gethsemane was a struggle? You know, I mean, he fights back and forth whether or not to go on with this. And Father, finally, he says, not my will, but thine be done. Before he says that, he says, if it's possible, let this cup pass. Now, this is a Jesus who doesn't know everything, step by step. Or otherwise, he wouldn't say, if it's possible, let it pass. And finally, he really doesn't get any answers. It doesn't seem. He says, your will be done. Your will be done. That's it. Okay. So we can identify with a Jesus who is as human as that the Word of God would have become so us. Why would he do that? Except, as I say, that God, through thousands of years, finally is up to here and said, all right, I'll send you my son. And if you can't understand what he says, you're out of here. I can't communicate with you ever, 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 or forever. Because he makes it very, very clear. Okay, I'm stopping for a moment.
Hi, I'm your host, Marsha Florence, but just as today, our show is Sarcoidosis Awareness. Hurry back and join us.